25 to 35% of all problems with neuropathy come originally from diabetes. But we're going to also talk a little bit about poor circulation a little later on. So what is neuropathy? Let's just get a quick overview. Degeneration or a dying off of the nerves in the periphery, meaning the foot or toes or fingers. But a lot of people say, well, my nerves are dead, my toes are dead, because they feel dead. They are numb, a lot of patients. Well, but they aren't really dead. They're just not working right. The nerves, by the way, are the first things to stop working when circulation in the toes or the fingers gets low. When we have decreased circulation for whatever reason, then we start having a dying off or a closing down of the capillaries, which are the little teeny tiny blood vessels inside all tissue. But what happens is, as we decrease the blood flow, the oxygen goes down. When the oxygen goes down, we have the first things that are going to be affected are the nerves. We're going to talk about that in a minute. Okay, so it causes what? Pain, numbness, tingling, hot or cold feeling, pins and needles, swelling, color changes. Some people tell me, my feet are on fire. Some people have to put their feet in ice at night because there's so much heat coming off of them. And other people, on the other hand, have so much cold, if you look at their toes or their fingers, they're actually blue. And if you touch them, they're cold. Okay. We can also get a redness. And we're going to primarily be talking about feet, but just assume that it's also about fingers, because sometimes fingers are affected as well. We can get a red coloration, a swelling, a heat, a redness in the lower feet and lower legs and feet. We can also get, what happens is sometimes they turn brown or grayish, and that's where the skin starts discoloring, and it's not the normal color, and so it gets brown or gray and really starts to cause problems. Okay, it can cause balance disorders, balance problems, and gait disorders, meaning people have trouble walking. Okay, anybody here experienced any of those? Any of those at all? How about those of you who are in? How many have we got in the healthcare profession here? Let's just see that first. Okay, a lot of you. Okay, but how many people have you seen with those symptoms? A lot? A lot. Okay, that's important. Okay, obviously it changes the quality of life. All right, where does it come from? I say too many calories, not enough insulin, and not enough absorption by the individual cells of the sugar that's in the blood system. And I say too much of too much. You know, let's face it. Oh, and genetics. Yeah, that's the one I like to say. You know, I'm diabetic, by the way. It's my mom's fault. She was diabetic, and damn it, she gave it to me. So when I was 50, or 48 or 49, I guess, I was diagnosed with diabetes, and I said to the doctor, who was a friend of mine, he said, you're diabetic. I said, no, I'm not. He said, yes, you are. You have all the symptoms. I said, I'm not diabetic. Well, he said, yeah, you are. I said, listen, my mom didn't get it till she was 70. So if I'm going to get it, I'm not getting it till I was 70. By the way, a lot of our patients are the same way. They're in denial. They live in Egypt, and they're living on the river denial. Okay. But listen, seriously, I was in denial. I said, and it took me 2 or 3 years before I actually got the big picture that I was going to die if I didn't do something about it. My son, who is a surgeon, came to me one day and said, Dad, Mom wants me to talk to you, and we don't talk about these things very often because that's our family. And he said, and I don't want to give you a hard time, but she says you're not taking your medication for the diabetes. I said, no, because I don't think I need it. And he said, well, and I said, besides, all those, I'm a chiropractor, by the way, so all those drugs will kill you. And he said, well, I got news for you. The diabetes is going to kill you way before the drugs do, so I'd say take the drugs if you want to live. And then a little later on, my medical doctor said to me, you're not taking your meds, are you? And I said, no, I'm not. And he said, well, he said, you better get your will and all that stuff made because I'll give you 2 or 3 years and then you're going to be dead. And you know what? I finally woke up and said, you know, probably a good idea to start taking care of this. I deal with a lot of people in nursing homes and that, and have on the south side of Chicago. In a very poor area, okay, very poor. And by golly, let me tell you something, they're all in denial too, especially the men, okay? So I just like to throw that out that it is a very common factor among patients. Okay, all right, so let's go on. Where does it come from? Too many calories, not enough insulin, high blood sugar. We did this, didn't we? Oh, it's the food of all. I'm sorry. Am I going the wrong way? Duh.
Still going backwards.
Oh, by golly. Okay, hey, listen, I can be retrained. I'm an old dog, but I can learn new things, okay? Okay, too much food, alcohol, smoking. Smoking is very effective, all right? A very effective promoter of diabetes is what I meant to say. Overeating, input versus output. You know, that's the same old story. You know, if you eat too much, you're going to have too much sugar in your body. If you burn 2,000 calories a day and you eat 4,000 calories a day, then your body turns your food into blood sugar, and if it's not used, it turns into what? Fat. Exactly right. You know, with women, it's kind of all over their body. With men, it's kind of around here. I tell people this used to be a six-pack, and now it's a pony keg. All right. Catch up. Come on. I used to be a stand-up comedian, but now I'm old. I have to sit down. So blood sugar is used. We all know how this works, right? The blood sugar circulates around your body. Imagine little guys or little gals running around with grocery carts full of packets of blood sugar, okay? They're the batteries of the cells. They power the cell. The blood sugar powers the cell. And then when your cell needs power, it takes on a new battery and it recycles the old one. And the grocery carts are kind of like insulin. Insulin supplies the blood sugar to the cell. And I told you I took a little poetic license, so don't kill me here. Okay, but what happens when the cells don't need new batteries? The grocery carts fill up, and they have to dump their sugar load back into the bloodstream or into something else, and it becomes fat. Meanwhile, more food is coming in, more food, and and we have so many grocery carts full of sugar that they start crashing into each other. Now, what happens is the cells in the body start to stick together. The fluid in the body, the fluid in the blood, gets so sticky, the cells, especially the red cells, start sticking together in strings or in clumps. And pretty soon, the traffic slows, just like us trying to get here today on the freeway, okay? Too many cars, nobody, we were standing, we was a parking lot. Okay. Of course, that doesn't happen in Chicago. Okay, so the same thing happens to your blood vessels. As your diabetes gets worse over the years, the blood vessels get more and more narrow, small, right? And as they get smaller and smaller, guess what happens? We have less blood flow. That's what we talked about a few minutes ago. Okay. More sugar builds up in the bloodstream. They stick together. We did that one. Okay. Decreased circulation primarily causes decreased oxygen. But it's also what else? Vitamins, minerals, nutrition, right? Okay. So the cells are actually, some of our cells are actually starving because they can't get the nutrition that they need. Kind of odd, huh? All that sugar floating around, but it can't get what it needs. Okay. Now, and that causes what we said before, dying off of nerves. It could also cause, what happens, by the way, and I think I've got another one here. Some of the first signs that diabetes is getting the best of you and starting you on the slippery slope to no return is itching of the lower legs, hands, and feet, burning sensations, cold feelings, pins and needles, walking on rocks. A lot of people say, I feel like I'm walking on gravel all the time. I feel like I've got sharp little BBs or something in my shoe. I go to check my shoe, and there's nothing in there. And I say, well, yeah, that's part of it, okay? Toenail discolorations. We see this all the time. Yes, it's a toenail fungus, right? It's a fungus in the toenail. Health people? Yeah? But why is there toenail fungus? What isn't the body doing? It's not cleaning out the fungus. It's not fighting the fungus. Why? There's not enough circulation of the good blood down there. Okay? Okay, lower leg and foot discoloration. Oh, poor vision. I kind of ignore this one because we're so focused on the feet, you know. But what's one of the biggest problems with diabetics? Macular degeneration, diabetic eyes, poor vision, very bad stuff, very bad stuff. I said this before, and your patients are going to say this, it can't happen to me. But I got news for you all, it's already happening. You know, even those of you who think it's not happening to you, it's probably happening to you.